I see a lot of new patients in my office, and very frequently they have a spouse or an uncle or a mom or a dad that they think they should get them in to see me. But they've told me that there's some hesitancy because, quite honestly, people seem to be afraid to see a chiropractor. And having been a chiropractor now for 42 years, I know how safe chiropractic is. We don't have a list of side effects that has to show up on an advertisement for some kind of drug where there's people that are in the shot that are laughing and dancing and walking and in the lower thirds running on the video, there's about 25 different side effects that run through. We don't have that in chiropractic. The side effect for chiropractic is that you get well.
Dizziness or fainting may occur upon standing.
Low blood sugar, which may cause symptoms such as sweating, shakiness, confusion, and headache.
Changes in mood, behavior, or thoughts. Increased appetite, trouble sleeping, dry mouth, diarrhea, and nausea.
Muscle pain or weakness, as they may be a sign of serious side effects.
Some risk of dependency. Driving, eating, or engaging in other activities while not fully awake without remembering the event the next day have been reported.
Common side effects are dizziness, sleepiness, weight gain, and swelling of hands, legs, and feet.
Abdominal pain and yellowing of the skin or eyes.
Because what we're doing is actually trying to find out what the cause of it is, and if the problem is there in the spine or the joints, then we have manual physical ways of mechanically correcting that to take the pain away. Probably 30 to 70% of the people that get adjusted the first time indicate that they're 30 to 70% better. And so that tells me two things. It tells me that they're not just really feeling better, they're really better because we didn't give them anything to cover up the pain. And the second thing is it tells us pretty significantly that we're working on the right spot. So it's greatly rewarding to me to take care of a patient that we have definitely found a spinal problem, and then we know what to do to correct it. It's like going to the dentist. The dentist isn't going to extract a tooth that doesn't need to be taken out, or he's not going to say that you have a cavity in a tooth that isn't there. There's objective findings for that, and we have the same kind of things. If the range of motion isn't there, if we palpate in a certain direction and there's more pain, if there's heat around that particular area of the spine, if there's reflexes that are innervated by the nerves that go to that area that don't respond, we have digital range of motion that we can check and compare before and after. There's orthopedic neurological tests that we do in those joints to determine if in fact there's a problem. So many different things that we do to find out if in fact the problem is where the pain is. Sometimes a person has pain and it's not coming from where the pain is. You may have pain down your leg, but the problem is in your lower back. There's many tests to determine if in fact you are a chiropractic patient. Like most chiropractors, I'll explain to a patient what we're going to do before we do anything, and oftentimes during the exam we'll explain things as we go because people want to know. It makes sense to explain something that maybe is new to them. I really enjoy taking care of a person that's never been to a chiropractor first. Sometimes they don't have a high expectation because maybe they've heard stories from people that have never been to a chiropractor. That's the best kind of story, right? It's somebody that's never seen a chiropractor that gives you advice about seeing one. People are surprised because we do a good consultation. We get the history. We find out what's going on with them in the past, what kind of medical care that they've had. And then they first come to a chiropractor. In my office, they're surprised about the level and the depth of exam that we do. I don't have any desire or need to take care of somebody that doesn't need chiropractic care. I think everybody should be checked, just like I think everybody should go to the dentist and have their teeth checked, but not everybody needs to have an extracted tooth, or not everybody needs alignment work on their teeth. That's what we find out here. It's just the facts, ma'am. It's just the facts. So if you're concerned about whether you should see a chiropractor or not, the best thing to do is call up, make an appointment, talk with the chiropractic doctor, let them understand your symptoms, and then if it makes sense, then you go forward with an examination to be able to find out exactly what the problem is. Next time you have a concern and that you think a chiropractor might be able to help, just give a call and make an appointment. I have a system in my office where there's no charge for a consultation. And a lot of times during the consultation, we can determine whether or not it's the kind of thing that we see frequently. If it is, it makes sense then to do an exam to figure out what's going on. So don't be afraid. Give us a call. Give your local chiropractic doctor a call and find out if you too can be helped with chiropractic care.